Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know Row, an informative conversation with leading physicians on important health topics. Today I'm joined by Kalia Skeet Jackson, MD, a physician specialist at Bergen Newbridge Medical Center in Paramus, New Jersey, and Rutgers, New Jersey Medical School. Dr. Skeet Jackson is board certified in adult echocardiography and board certified in nuclear cardiology. Her interests include preventative cardiology and medical education. A person's race and ethnicity shouldn't put them more at risk for having heart disease or stroke, but unfortunately, it often does. Cardiovascular disease, including heart disease and stroke, remains the number one killer of Americans, and there is a disproportionate toll on communities of color and communities that have challenges or hesitation accessing healthcare. Today, Dr. Skeet Jackson and I will discuss the importance of education, compassionate connection, and accessing to care for communities heavily affected by cardiovascular conditions. Welcome back. Thank you so much for joining me on this last day of Heart Month.
Yes, thank you so much, Rosemary. That was a very nice introduction and a very good summary of what's actually happening.
So, who's dying of heart disease in the United States?
Well, the short answer is everyone. Um, all genders, men and women, all races, all adults over 35 are at high risk of dying from heart disease. In fact, heart disease is a leading cause of death in adults in the United States, no matter your race, your class, your creed.
So, does it vary with ethnicity, age, and other factors?
Yes, it does. So, generally, the older you are, the more likely you are to die from heart disease. In terms of ethnicity and race, um, if you are Black, Hispanic, if you're Asian American, or even a Pacific Islander or Native American, you're more likely to die from heart disease than your white counterparts. So, heart disease is the leading cause of death for everyone, but certain racial and ethnic groups are at higher risk of dying from heart disease. Uh, when you take the data over the last 18 years or so, overall, the number of people dying from heart disease has decreased in all racial and ethnic groups. However, Black people and Black and African American people are still twice as likely to die of heart disease than white people.
And what are those risk factors? Explain that. How's that different, or is it the same?
Well, the risk factors are the same for everyone, but what we
Okay.
do find is that certain racial and ethnic groups have a higher incidence of these risk factors. So, overall, what are the risk factors for heart disease? There are risks that you can modify, and there are risks that you cannot. You have no control over. The ones that you have no control over are the ones you're born with. So, your family history, if it runs in your family, if your mom or your dad or first degree relative, brother or sister had a heart attack, especially at an age less than 60 years old, that increases your risk of having a heart attack. Similarly, for strokes. Um, Things that you can modify: smoking, having a sedentary or a lifestyle that's not very active. These are modifiable. Other things: obesity and chronic diseases. The chronic diseases are the major risk factor for heart disease. So high blood pressure, also known as hypertension, diabetes, uh, high cholesterol. These are the three things that generally really increase our risk for heart disease. And what we've found that certain ethnic groups have a higher incidence of these risk factors and are then at a higher risk of heart disease. So, high blood pressure or hypertension, if you're Black, you're at a very high risk compared to your other counterparts. Um, Elevated cholesterol, if you are Hispanic or if you're Asian, you're at the highest risk compared to your counterparts. Obesity, similarly, is higher in the Black and Hispanic population compared to the white. Smoking, we find that the highest incidence of smoking occurs in the Asian population in America. And so the heart disease will have an increased risk in these populations.
So you're talking about a lot of cultural pieces like diet, things that we grew up with, things that are embedded in us from when we're children.
Right.
How do you make those changes? When you're so used to eating a certain way, you go back to your comfort. We talk about comfort food. When we're going through something, we're going through stressors, what do? We go back to what makes us feel good. So when you're sick, what do? We go back to what mom used to do to make us feel good. So how do you find that balance?
I think it starts, well, there's several levels to it. So, there's individual level, there's the healthcare provider level, and then there's a systemic level, the healthcare system level, in terms of what needs to be done to change these different risks in different populations. Why is it important that, in different populations, races and ethnicities, heart disease is a higher incidence? Well, because overall, it costs money.
Right.
If more people are sick, more people have a more severe form of illness, it's a higher burden on the whole healthcare system. It's a higher burden on the taxpayer. It's a higher burden on the country. There's more people in the hospital that need more resources. And so there's less for everyone. So if at the preventative level, we can prevent or improve the risk, then we will prevent progression to outright heart disease that in the long run costs more money. So at the individual level, you just mentioned diet. I think it starts with just getting ourselves more educated. And this kind of forum is exactly what needs to be done. Community outreaches to educate people on diet and exercise, television ads, things in the media, telling people about diet, exercise, stopping smoking, that kind of thing. So what kind of diet should we be having? We should be having a diet that's lower in salt or sodium, lower in processed foods, processed meats, and higher in fresh vegetables and fresh fruits. If you're diabetic, you should be having a diet that's lower in carbohydrates and sugars. So overall, what can we do day to day? Eat less fried foods, eat less oily foods, eat less greasy foods, the stuff that we like, the stuff that tastes good. Find a different way to prepare it. Instead of frying the chicken, put the chicken in the oven, broil the chicken or bake the chicken so that the oil leaves the meat. Eat more fish. Eat fish once a week instead of not at all. Have meatless Monday. So these are the small things we can do, and eat less salt. Feed your children less of these foods so that they get more accustomed to fresher foods, fresher vegetables, more fruits. That's at the individual level. I think I answered what you asked.
Yeah, absolutely. And I and going back to all the points that you said, access, it's difficult, to find those fresh foods, especially in some of the different areas. So I grew up, in the city, in the Bronx. My parents didn't drive. So, I had to go walking distance. And I remember walking to the little store down the road. Access was difficult to find, fresh fruits and vegetables, and that's a whole other factor, isn't it, doctor, that, that can be contributing to some of these, related issues, social economic issues to heart disease?
Most definitely. And the reasons that the risk factors for heart disease are different in different populations are at many levels. So we started with the individual level. We'll jump to the systemic level. So we talk about food deserts. In some communities, it's very difficult to access fresh food. It's very difficult to get fresh vegetables and fresh fruits. It's very difficult to get a drink that's not soda.
Mm-hmm.
So this is something that has to be changed at the systemic level, the community level. This is where we talk about speaking to our state senators, writing our congressmen, speaking to our senators about our communities and what we notice in our communities compared to communities that are quote unquote more affluent, right? In communities that have people of color, there are generally access issues. There is generally less ability to exercise for children. There are less playgrounds and less parks. So these are things that at systemic level can be improved to improve the overall risk for heart disease.
And let's talk a little bit about, access to even the elderly. So, you were talking about age being a factor of
Hmm.
heart disease. And as you get older, and I'm going to use my mom as an example, she has heart disease, she doesn't drive, and how difficult it is, to get her to the cardiologist
Right.
often. You know, that is a contributing factor to people dying.
Yes.
Am I correct?
Correct. And that's where we talk about access to healthcare as another factor. Um, in general, overall, in the past few years, hospitals have been closing, due to lack of funding, poor profits, and the non-for-profit sort of healthcare system is on the decrease, and the for-profit is on the increase. Bergen Newbridge Medical Center, of course, does fill that gap in this community.
Hmm.
So this is also on a state and federal government level, that there needs to be a broader scope for people to access healthcare in many different settings, whether urban or rural, so that most people should be at least close to some sort of hospital system to access a higher level of care or an emergency room.
So how do we decrease the risk of heart disease in these communities?
Okay, so if you have a chronic disease, like diabetes, high blood pressure, high cholesterol, you need to be seen by your doctor regularly to make sure that you're controlling that risk. You need to get your blood levels checked to make sure that your numbers are where they should be. And you need to have your blood pressure checked to make sure that those numbers are where they should be. It's when these chronic diseases are uncontrolled that your risk for heart disease skyrockets. Um, Modifiable things: if you smoke, you really have to stop smoking. Generally, smoking, is generally on the decrease. Unfortunately, we see the increase of these non-tobacco products. As of now, we do not have the data on the general effect, but data has shown that these are also associated with some risk. So I would say do not convert to a non-tobacco agent. Speak to your doctor about getting a patch or some form of medication to help you quit smoking altogether. Get moving. If you can walk, walk. If you can't walk, sit and cycle at home. Perhaps you could get a stationary bike at home. Perhaps you could join the YMCA and do some laps in the pool. Get yourself moving, because a sedentary lifestyle increases your risk for heart disease no matter what your weight is. So it's better to be overweight and moving every day, exercising, than to be super skinny and not moving at all in terms of
Wow.
your risk for heart disease. Um, so we spoke about those things. So exercise and then diet. We spoke a little bit about diet. Try to take a diet that's lower in salt or sodium and lower in fat, lower in processed meats and other, hyper processed foods. Try to lean towards vegetables and fruits, complex carbohydrates, and not fried foods, unfried foods, like, and fish, of course, and nuts.
So, are there differences in recommended treatments?
Okay. Generally, treatment guidelines are the same for heart disease, especially once heart disease is diagnosed. There may be differences with individuals depending on their ethnic group or race when it comes to certain specific diseases, such as heart failure. Certain medications have been proven to work better or improve the mortality better in perhaps Black people than in other ethnicities. So those medications would be first line for Black people. Other than that, and that's, a very specific thing, but other than that, the treatment remains the same. get to your doctor, get your risk assessed, and get yourself on treatment. That's the take home message.
So that basically, if you have heart disease, the and have risk factors, the access and staying on top of it is the key,
Yes.
correct?
Yes, that's a key. There's one thing that I left out. We spoke about the individual level, what we can do. We spoke about
Hmm.
um, the healthcare system level. A
Hmm.
third parameter, which we have, seen in the medical community, is what we call, unfortunately, bias. So we as healthcare workers, doctors, nurses, and all involved in the care of the patient have to make sure that we do not have, unconscious bias towards patients, no matter what their race is, no matter what their gender, their sexual orientation or identity, no matter their age, to make sure that we're giving everyone the best treatment, no matter who they are.
Oh, absolutely, absolutely. And I'm to top that, stressors are a big factor to this.
Hmm.
Day-to-day stressors, and I know as a mom and and I work full time, you always find that excuse to not make it to the doctor. So that's a
Yes.
big piece. We talked about that earlier in the month of,
Hmm.
those signs, when you're not feeling well, that you need to go and see the doctor. You have to see the doctor, and you need to make health a priority. And I think that's the biggest contributing factor, especially when it comes to culture. When you think about all of those pieces, a lot of cultures put their health behind them because there's so many other things that take
Right.
priority. Their family, their job. It's always something else that's
Right.
taking priority. And it's unfortunate that that's what takes their life at the end of the day. Um, am I correct
Yes.
in saying that?
Yes, this is very true what you're saying. I did not go over symptoms of heart disease in this session. We usually do. If you're having chest pain at any time, if you're having shortness of breath, if you're having racing of the heart, lightheadedness, if you faint, if you notice your legs are swollen, if you notice that you're winded or short of breath, when you're walking up the stairs or doing exercise that you usually are able to do, these are signs that you need to go get your heart checked. Uh, some people access care only when they're feeling sick. We need to change this paradigm. We need to go see a doctor every 6 months to 1 year and get ourselves checked out, check our cholesterol, and check our risk factors for all diseases, not just heart disease. What you just said, Rosemary, is very important. People tend to put everything else in front of themselves, especially when they are the primary breadwinners for their family, and especially if them missing a day of work will be so detrimental on the next meal or something else, right? But we do have to start putting ourselves first. We do have to try to take a few hours to get that appointment somehow from work to make sure that, unfortunately, that when we get to access to healthcare, we're not basically on the verge of dying, because this is what happens, especially in lower socioeconomic communities.
And that's the truth.
Yes.
I mean, and it's sad. It truly is
Yes.
because it happens way too many times.
Hmm.
You read about it, you look at it and you're like, what in the world?
Right.
And at the end of the day, they were doing the best they could with what they had, for their
Right.
families,
Right.
and it's heartbreaking. It truly is because they made the ultimate sacrifice, you
Hmm.
know, um, and that's themselves.
Right.
So, an hour is not a sacrifice,
Right.
and that's what we talked about, compassion and connection, and that's what
Hmm.
we have here at Bergen Newbridge Medical Center is exactly that. We understand,
Most
what it
definitely.
means to have the working family,
Right.
so but I think we covered everything,
Hmm.
doctor.
Yes, we did go over a broad um, range of things. Yeah. Thank you so much, Rosemary.
I appreciate your time, and it's so very important to take care of your heart, and not just in the month of February, but
Right.
every day. And if you would like to make an appointment with Dr. Skeet Jackson, I applaud everyone to make that appointment at 201 or please visit us on our website at Bergen Newbridge, actually newbridgehealth.org.
Okay.
And please support our foundation. And I wish everyone health and wealth always. Thank you again, Doctor.
Thank
Take
you so
care.
much, Rosemary. Bye bye,
Bye
everyone.
bye.